So here I'm going to tell you about the instruments and what are their use. So first of all, I'm going to tell you about the pins. So you can see that there are so many pins. So what is the difference between these all pins? So you can see that the all ends are blunt here, and there is a cut end, and on other side there is a sharp end. So what are these instruments? So this is the serrations in between these pins. This is called as Denham pins, and this one is which will not have any serrations, one-sided blunt end and other sided sharp end. So with no serrations in between, this is called as a Steinman pin. Okay, this is Steinman pin and this is Denham pins. So these two pins are used for skeletal traction. So these pins are used for skeletal traction. So in the Denham pin is used in old age, like osteoporotic bone, and this one is used in non-osteoporotic bone, like in adult bone. Now third one is where the one side is blunt and other side is serrations is not in between, but so this is called as a Shange pin, where the one end is serrated with sharp end, and here is the one end is blunt end which holds for the drill, and other end is sharp end, but the serrations is like to make a hole inside the bone. So this is called as drill bit. So this is called as a drill bit. Okay, now come to the other instruments. Now I'm going to discuss about the retractors. So these three retractors are used to retract the muscles surrounded the bones. So this one is Zerny's retractor. Okay, this one end is this side and other end is opposite side. This opposite jet shape retractor is Zerny's retractor to use and retract the muscles surrounded the bone. And this one is L-shaped retractor. This L-shaped retractor is Langenbach retractor. Okay, now this third one is, so this is the Homan's retractor. This used to retract the muscles around the bone. So it helps to indirect retraction of the muscles. Now come to the different type of clamps. So this clamp, you can see that this clamp is bone holding clamp. In this have serrations and there is a teeth which helps to hold the bone and used to, in reduction of the bone. Okay, and this one is the one end is serrated with other end have teeth like structure, and this retractor is called as plate holding clamp or plate holding clamp. Okay, this helps to hold the bone along with the plate to reduce the fracture. Okay, now third one is this is not a bone cutter, so this is the bone nibbler. So this structure is like a beak of the bird. It helps to nibble the bone, like nibble, 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 nibble. Okay, this is the bone nibbler. Now the fourth one is, so this one is the bone cutter. So in this there is a sharp end. Okay, so this sharp end helps to cut the bone. Okay, so now I'm going to tell about these four instruments. This one is sponge holding forceps. It used to hold the sponge painting with the betadine over the surgical site. And this one is this instrument is called as Alice forceps. In this you can see this, now you can see it. So this one is, there is a serrations, there is a vertical serrations or the tip of this forceps. So this is the Alice forceps. Alice forceps is used to hold the tissue. And this one, these two instruments is, so these two instruments is curved artery forceps. So look at this, this is the curved in shape. This is the curved artery forceps, and this one is the mosquito forceps. Mosquito forceps is small. This is a small, medium, and another one is large in size. Okay. So now the most confusing part is this. So this is the osteotome. Okay, so what is the difference between osteotome and chisel? So look at this. There's a in this osteotome you can see there's a both hand are beveled. Okay, on this side and this side, these both hand are beveled. It means tapered. Okay, but in chisel, which I have not, but the chisel there's only one side is beveled, other side is straight. Okay, so this is the osteotome, another one is chisel. Now come to this, and this is a periosteal elevator. With this area is a thumb rest. You can rest this thumb over this periosteal elevator and elevate the periosteum over the bone. Okay, this only one side is beveled, another side is straight. But this is the not a chisel, this is a periosteal elevator. Okay, now this curved instrument is called as bone goose. It helps, what is the use? It used for to take a bone graft. We take out the bone graft from the bone and place over the other side. And this one is a towel clip. Okay, this one is a towel clip. It's used to hold the towel and clip and lock it. It used to helps in dipping. So this is the towel. You can clamp it like this. So this T-type instrument is a bone tap. You can see that this is the handle shaft, and there is a serrations on one end. So it used to make a hole. It make a hole inside the bone so that the screw can pass easily. Okay. So this is also a drill bit. You can see this only one side cut end is used to hold the one end the drill. Other side is serrations, which helps to make a drill in the hole in the bone. That's